Well, good evening, everybody. Welcome to the webinar. And tonight we're going to be going over the most common ocean infection control violations we've seen here at Compliance Training Partners over the past year or so. My name is Carson Carpenter. I'm the president of Compliance Training Partners. And what you're going to see tonight is really a summation of the things we've run into with clients over this past year. Over the years, we've been involved with a lot of OSHA inspections, and I think we can give you a good feel for where you might be vulnerable, where you're good, and see if we can help you tonight. It's not going to be as hard as you think. It's really not. Now, let me just go ahead and go. The first one, really a simple violation, easily cured. Not having a written hazard communication plan. I always say write one or buy one, have a written hazard communication plan, because it's one of the first things that an OSHA compliance officer would look for. Not only that, it's a really good thing to have. It really can make your training much easier, and I'll show you how. First of all, just a little background. I'm just going to give you, I guess I'll call it the 50,000-foot view of hazard communication. Well, with a written hazard communication plan, this plan talks about, how does the system work in your office? For example, you get a new employee. How do they access safety data sheets? What about labeling of products? What type of personal protective equipment do you have available? And how do people get trained? So this would all be in your written hazard communication plan. Because hazard communication, this is that law that's known as often as the right to know law. Basically what it says is you get to know in an office as an employee what you work with. You get to know how to protect yourself. That's really what it's all about. Employees also, they need to know, of course, what type of safety measures you have, including PPE, what type of things are available to protect them, because we all have chemicals in our offices. So some of the responsibilities that people have are listed on this slide, and this is why one of the things I'm really going to encourage you to do is assign somebody to have the responsibility for OSHA compliance. I would pick a trusted, well-organized clinical person. So somebody in the back office, not in the front office, somebody who understands the back office. So a trusted assistant, a trusted organized hygienist, because some of the things that they'll need to do, have a hazardous chemical inventory. Make sure that for every hazardous chemical on that safety data, or on that list, you have a safety data sheet. Make sure that these containers that have chemicals in it are properly labeled so people know what's in them. Having an employee training program, and of course, that encompasses a number of things. Onboarding that new employee, letting them see the written programs, showing them the different protective measures that you have in the office. And the last one, developing, implementing, maintaining a written hazard communication plan. Now, that doesn't mean that they have to write it. They can purchase one, but of course, it always has to be customized because there's always going to be some work. But put somebody in charge. That's how you're going to get through an inspection. Let somebody help you. Hold somebody accountable. Now, I mentioned the chemical inventory list. Not as hard as you think. This is, of course, a list of hazardous chemicals you have in your office. And I'll show you a slide in a minute what some of those could be. This list needs to be updated if new products come in. But the good thing in a dental office, and I practiced dentistry for many years, and I know that once we get this core group of products, we don't change things a lot. It's not like there's new products coming in every week. We tend to use the same restoratives, disinfectants, bonding agents, etc. So a great way to get this list is contact your supplier and say, look, I'd like a query. I want to query everything that I purchased in the last 18 months. So now you've got a list of things you've purchased from them. Pretty easy to transfer this over, say, to an Excel, a spreadsheet, or a Word document. Now you have a great chemical inventory list. Where would I put it? Make sure you put a copy in your compliance manual. make sure you put a copy someplace where everybody can see it. I say a prominent place, like a kitchen or a break room, someplace where all the employees are going to know where it's at. And I mentioned labeling. This is not nearly as arduous of a task as you might think, because yes, things that are in unlabeled containers need to have a label like this. This is what's called a globally harmonized system, GHS label. But things in their original container do not, because the labels that are on those original containers, they've already passed scrutiny. It's when you take things out of the original container. And I find in a dental office, there aren't that many things that need to be labeled. I'm going to say maybe a dozen. Almost everything we leave in the original container. But I'll give you one example. Let's say you buy an ultrasonic enzymatic solution to put in your ultrasonic in your sterilization lab. Well, comes with a label. Everything's fine. But now you dump it into the ultrasonic. Nobody really knows what it is. So have a label like this, either on that ultrasonic or actually, even better yet, on the wall right behind it, so it's not constantly getting wet. So again, unmarked containers need to be labeled. Employees need to know how to read these labels. That's really important that they know what these labels mean. So you might say, well, how do I know what's hazardous? Not as hard as you'd think, because it's almost everything in the office has some level of hazard, whether it's a cleaner, a disinfectant, our bonding agents, our restorative materials, even plaster, stone, and alginate all pose respiratory hazards. So you would find them on OSHA's hazard communication list. Now, believe me, dentistry is not inherently dangerous, not in any way. In fact, maybe it's actually safer than being at home, because we all have hazardous materials in our garage, our barn, our basement. But in dentistry, when we have employees, we need to have a formalized program listing those. So there's nothing particularly dangerous about dentistry, believe me. All the studies show that. So this is what a manufacturer's label is going to look like. Today, they'll all be what's called GHS, Globally Harmonized System compliant. They'll have a product identifier. They'll have contact information for the manufacturer. They'll also have a signal word on it. And a signal word is going to either be one of two words, either danger or warning. Now, if it says warning, that's a less severe hazard. Obviously, you'd still pay attention to it. A typical thing in a dental office might be warning, contains isopropyl alcohol. Or if you see the word danger, staff should know this is something you really pay attention to. Some things you may have in your office that would have the word danger on, hydrofluoric acid would be one, for example. If you have formaldehyde, that would have the word danger on. And of course, these labels have pictograms. And I mentioned it's really important that staff know how to read these labels. Pictograms make it easier, right? They're pretty intuitive, but not completely, right? To me, there's 9 of them. A couple of them, like the one on the top left, explosive, that's pretty straightforward. Bomb going off. Or the one for flammable, that looks like a fire to me. But I wouldn't know, probably if I didn't do this for a living, that exclamation mark on the lower left means harmful. So it's really important that everybody know how to read labels, know what these things mean. That's part of it. So I always say, buy one or write one, but have a written program. It's very important. One of the first things that OSHA looks for, and it's a great thing to have. When you bring on that new employee, it's so nice to have one. The next thing that we see is material safety data sheets either missing, maybe there aren't any, maybe they're not organized so that people can find them. But a safety data sheet, of course, is that detailed information on the particular product or chemical that you're using. It has 16 sections that go over things like fire hazards, first aid measures, how to pick up a spill, but they need to be on site. So make sure you have these safety data sheets. Make sure you don't have the old MSDS sheets. A lot of people still have the old MSDS sheets. Those are really obsolete now. The other thing you want to keep in mind is you need to have somebody responsible for these. I'd make it the same person who's, of course, in charge of OSHA. And really what they need to do is they could put them in a binder like this in alphabetical order. Pretty easy. You just download them from the website, print them, put them in a binder. If you want to go electronic, download them onto a dedicated laptop. I would pick a dedicated laptop, maybe bring in an old laptop. We all have them that we don't use anymore. Put them in a folder in alphabetical order in that laptop, because you've got to maintain them for 30 years. So what won't work is this. If you say, well, if I have an emergency, I'll just go to a company's website and find the safety data sheet. Well, some companies have, thousands of SKUs. And what if the internet's down? So we find that people can get violations for not handling these safety data sheets properly, not having them accessible. Again, they've got to be available, got to be accessible. People need to know how to get them. Now, another violation that we've seen often is not having an eye wash, or having an eye wash that's not functioning, or it's not being tested properly. Again, this is a really easy thing to comply with. In fact, most of the things I'm going to show you tonight, OSHA's not really throwing curveballs at you. They're pretty straightforward. But let me show you where you can run into problems. Because most of you probably have an eye wash. That doesn't mean you're compliant, and I'll tell you why. By the way, let me mention, if anybody has those eye wash bottles, you've all seen them, right? These plastic bottles, they have a little jet on the end of them and they say eye wash. That will not fly, because you have to be able to flow both eyes at once, so binocular, and you have to be able to put out a half a gallon a minute for at least 15 minutes. So believe me, those bottles won't do it. You need to have something like this eye wash you see in the picture. These eye washes need to be within 55 feet of any chemical hazard. So if you had it in the center of the office, not too many people have an office more than 110 foot long. You probably only need one. If in doubt, put a second one on another sink. But what a lot of people don't realize, it needs to be inspected and activated weekly to be in compliance. Now you might think, oh no, this is going to take a lot of time. It isn't. We're talking about 20 seconds. Basically, we're talking about turning on the water, pulling this silver button. The water goes to those green caps and shoots them off. So the caps come flying off, the water runs, let it run 20 seconds, done. But document that you've done it. Somebody needs to be in charge, needs to be documented. Easy to do, but a lot of people we just don't realize we have to do it. Now here's another one we see. Not offering employees hepatitis B vaccine, or even more often, not having to sign declination form for those that don't want it. Because I think you would agree, since the hepatitis B immunization has been really offered as part of the childhood immunization series, since probably the mid-90s. Most people have had it. Not everybody. We can't assume that everybody has it. So the problem comes if you don't have record that they've had it, or you don't have record that they don't want it. Just a little quick background. Hepatitis B, of course, causes liver inflammation, cirrhosis. It can be fatal. It can live outside the body at room temperature, so on our dental unit for a week, which is pretty impressive. Very transmissible. Think about it, 100 times more transmissible than HIV. And transmission, sexual contact, contaminated needles or sharps, which is our big concern in an office. Mother to child during pregnancy or birth. But again, this is one of the most successful immunizations ever. For most people, it imparts lifetime immunity, no booster needed. But this immunization should be offered to all healthcare workers, because this can't be cured. Now, here are some of the exposure control plan requirements. You need to have this information in your exposure control plan, and you need to, of course, not only offer this immunization to employees at no cost, but if an employee declines, they say they don't want it, and that's most likely what's going to happen, is they're not going to want it because they've already had it. Okay, but you've got to have them sign a declination form. So in their employee medical record, you need either the declination form signed saying they don't want it, or a copy of their immunization status from their physician or wherever they had that immunization done. So you got to have one or the other in the employee medical record. And I won't read this exactly, but just to paraphrase it, it's got to be these exact words. Basically, I understand this is a very dangerous. Hepatitis B is extremely dangerous, could be life-threatening. I've been offered the vaccine. I've decided I don't want it, even though there's a risk. But I know that in the future, if I want it, all I have to do is ask for it and I can get it. So make sure you have these, a simple thing that can get us into trouble. Now here's another one. In our webinars, at Compliance Training Partners, we did over 100 webinars last year. Although I'm trained as and that's in dentistry, although I'm trained as a dentist, our company deals closely with physician offices across the country, veterinary offices as well. But when we do webinars for dentists or physicians, when I do a poll on how many people realize that there's this requirement, it comes in only about 18, 19%, usually never hits 20. But we actually have to do a baseline TB test. First of all, TB, of course, it's not bloodborne, it's airborne. It's spread from coughing or speaking, laughing, sneezing. So the concern is bringing or breathing in aerosols or droplets, which is how transmission occurs. And there are two types of what are called TB conditions, either latent TB or TB disease. And really the one we're most concerned with is, of course, TB disease. Latent TB, yes, the lungs do have the bacteria. They're not actively reproducing. Therefore, the patient's really not infectious. They don't display symptoms. They can actually be treated in the dental office. But what's a little scary is they will show a positive tuberculin skin test. Now, TB disease, these people are very contagious, actively reproducing bacteria. Typically, they're quite symptomatic. They're going to know something's wrong. You're going to know there's a respiratory disease there, but they can't be safely treated in your office. Not unless you have, none of us have a facility like that. We'd have to have a UV irradiation of the air, HEPA filtration, wear N95 masks, have negative air pressure in the room. So that's just not most of us. Typical symptoms almost sound a lot like COVID, right? Fatigue, fever, weight loss, night sweats, and most of all, this chronic cough where you have a chronic and productive cough, coughing up blood and mucus. Now, fortunately, we are in TB risk category. We're considered a low risk, unlikely to see TB patients, particularly with the great screenings we do since COVID. All we need to do is have a baseline test, just a baseline test. And what I would do is make sure you form a relationship with a local occupational medicine clinic. I would give them a call, say, Google up occupational medicine clinic, Sacramento, California. We're a local dental office. We'd like to send people to you for a baseline TB test. And by the way, it should only be about probably $25 to $40, one time only. But we also want to have a place we can send people if there's a sharps injury, if somebody needs hepatitis B vaccine. So I would try to form that relationship ahead of time. But regarding TB, again, we need to defer treatment on those patients. We can't see them. It's too dangerous to treat them in our office, according to OSHA and CDC. Not provided training. This is something that we see so often in OSHA violations. Often it's someone forgot to do the training. Maybe they did the training but don't have record of the training, which is why all the training we provide, we make sure there is a post-test and a certificate of completion, because this is gold in the event of an OSHA inspection. So training's required for all employees. Sometimes people will call our technical services line, Compliance Training Partners, and say, well, I've heard that our front desk people don't need to be trained, just the people who work back in the clinic. No, everybody needs to be trained, everybody in the office. And keep in mind that sometimes people confuse OSHA and CDC. OSHA literally cares only about employees. OSHA does not care about our patients, not at all. They're only concerned with employees. But OSHA training, of course, it's required annually. It's required as part of the onboarding process, which is why I would like to see you, even if you're doing, say you're doing a webinar with us, an annual retraining webinar, which this isn't. This is just a 50,000-foot view, top violations. But say you're doing that, you still need to have some online training available so you can onboard that new employee. And when you stop and think about it, it's good, it makes the office safer, it's the right thing to do, and it really reduces liability for your business a lot. And of course, training is not, it's almost like it didn't happen. It's like our patient records, right? Well, if it's not written down, it didn't happen. And this is where we'll see people get into trouble. Well, I did training, but there's no record of it. So we need to have the dates of the training, the contents, what was covered, who did the training, what were their qualifications. So keep these training records for 5 years. If you have an inspection, I want you to have these training records. By the way, we will open it up to some questions at the end too, because I know there's some questions here. The next violation, failure to provide post-exposure treatment and counseling to an exposed employee. So in other words, somebody had a needle stick, nothing is really done. You know, wipe it off, put on a Band-Aid, you should be fine. That patient, known that patient for years, right? They couldn't have anything. Well, in our exposure control plan, first of all, it needs to state post-exposure evaluation. This is made available free of charge when there's an exposure incident. This is something that's available to all employees. So in your plan, you need to have details on what to do if something like this happens. And what it should talk about is, first of all, notify whoever you report to, whoever your supervisor is. Just simply wash that. If it's a needle stick, with soap and water. If it's nose or mouth, of course, flush it with water, which is a great reason why to always keep safety glasses on, to keep mask on, then you won't have to worry about that. If the eyes are splashed, use the eye wash. Irrigate the eyes for 10 minutes. And now it's time you want to make sure that in your written exposure control plan, you have a written incident report. You have forms ready to go. So keep in mind, regarding the written plans that are so important that we see people get into trouble with, for hazard communication, you need to have a written hazard communication plan. For bloodborne pathogens, that plan is called the exposure control plan. And you need to have a written exposure control plan. It would have made a lot more sense if they would have called it the bloodborne pathogens plan, right? But they didn't. So on this written incident report, this is where you're going to put, when did it happen? Who did it happen to? How did it happen? Name of the source person to whom you were exposed. Name of the employee, of course. So again, have these things ready to go. And we actually have it set up where we have a form for the patient, a form for the employee, a form for the occupational medicine clinic. And what happens when you go to have that evaluation? Well, first of all, they're going to identify and test the source patient. And what they would really do would be a rapid hepatitis B, C, and HIV test. So they would collect the worker's blood, collect the employee's blood, offer any post-exposure prophylaxis. What if that person had never had immunization? Well, they might recommend starting hepatitis B immunization or maybe an immune globulin injection. And of course, they're going to follow up any reported illnesses over time. So again, have these things ready to go. We even have on our plan where we actually have a map, a phone number, contact name at the occupational medicine clinic, these forms for the patient and the employee all stapled together. So a post-exposure packet ready to go. It's very reassuring to an employee when something happens too. They really like this. So imagine that the employees receive this follow-up. Well, now they're going to, there's a couple things that will happen. Whoever provided that treatment, they're going to provide a follow-up. They're also going to give a written opinion that will be sent to your office regarding work duties, evaluation results, any further conditions that need treatment. So there needs to be a plan here. And this one, number 8, this is just not having a written exposure control plan at all, just not having one. Because again, it's required, it's got to be in your OSHA manual. If it's not, it's just an automatic violation. And some of the things that need to be in the plan, it's just simply a listing of the hazards you have, the tasks that you perform that could expose employees, which employees are exposed, what PPE you have, how is training done, and the use of PPE, for example. These things need to be in the plan. Other things, standard precautions, which is one of the basic tenets of infection control. What engineering and work practice controls you use. The housekeeping that's performed. So in other words, what's done, between patients, twice a day, once a month, how you keep house, if you will, in your facility, how people can receive the hepatitis B immunization. And of course, it explains thoroughly and has all those post-exposure evaluation forms in there. Now, standard precautions, again, it's just, again, treating everybody the same. And that is whether it's a patient who you suspect is a serial drug abuser, or your best friend, or the local clergyman. It's the same disinfection in the operatory. It's the same processing of instruments. It's the same personal protective equipment. So this all needs to be in there. And engineering controls, different offices use different engineering controls, but engineering controls, these are mechanical devices, as the name applies, that make the office safer. So you want to actually have documented what engineering controls you use. This needs to be in the plan. And there also needs to be an area, in our plan, we leave multiple blanks where you can write up to a paragraph each year, where staff as a whole gets together and says, hey, is there any technologies out there? Are there any mechanical devices that could make things a little safer for us? So that actually needs to be talked about. It needs to be documented. And this is something that if you don't have it in an exposure control plan, it's problematic. And I'd mention the housekeeping schedule, a simple thing that we find so few people have. And this is what it looks like in our manual, something where it's posted. Of course, it's in the manual, but we also post it so people know they're all on the same page. So the same exact procedures are being done in operatory 1 as in 6 and 10. Everything is done the same. So a written housekeeping schedule. Now, sometimes people will get into trouble too because they don't have an exposure control plan, or they haven't covered regulated waste in it. And it does need to be discussed. And first of all, I want to mention non-regulated waste, because non-regulated waste, that's the bulk of what we have. We're talking about like 95% of what we create is non-regulated waste. It can just go in the regular trash. Where regulated waste, this has specific disposal requirements, right? We're talking about things like sharps, for example, that have to go in a sharps container. Now, when it comes to sharps, remember that an area where we'll see a problem is when that sharps container is not located right in the area where you generate it. In other words, if you have one large sharps container back in the sterilization area, you're carrying these sharps through the office to dispose of them, I wouldn't do that. I would have a smaller sharps container in each room so that it can be immediately disposed of. We see people get into trouble when they don't. And of course, if you're buying a sharps container from a reputable dealer, it covers all these things. It's closable, it's puncture resistant, it's leak proof, it's already labeled or color coded. But the two things you can control, making sure that you have one in every room, every operatory, making sure that people know when it gets about 7/8 full, cap it up and put out a new one. We've been involved in too many needle sticks over the years where it came from jamming that last needle into a sharps container. And to me, that's the worst kind of, it's the worst kind of sharps injury, because at least I always say, if you were exposed to Mrs. Smith, a needle from Mrs. Smith in room 2, you know who to test. If you're jamming things into a sharps container, you have no idea who you were exposed to. And of course, the exposure control plan also talks about the PPE that you use. And of course, PPE it's got to be provided by the owner. It's got to be maintained and cleaned by the owner of the practice. You can't, in other words, employees can't take protective clothing home to launder. It needs to either be washed in the office or by a laundering service. So really, what you could do, there's a couple options there that will keep you bulletproof. One, you could do what we've always done. It goes back to when my kids were little. And this was even before these laws, I just didn't really want to go home with amalgam dust and blood residue on my pants and shirts. So I started wearing long sleeve scrubs, scrub pants, left a pair of tennis shoes in the office. And I practice just occasionally here and there now, mostly on my family and friends. And I still dress that way to this day. And we would then leave that in the office. We had a washer and dryer in the office. We first had a small office, so it was a stackable washer and dryer. We then had a larger office with a basement. We had a full-size washer and dryer in the basement. Now, your other option, if you say, well, we really like people to wear short sleeve scrubs to and from home and wash them at home. You can do that if you have a long sleeve, knee length, high necked lab coat that you leave at the office. That lab coat protects those scrubs. Okay, so you've got to have something that you're leaving at the office. You can't be taking that home. Now, these are the main areas that we see, the most common areas we see in hazard communication, bloodborne pathogens. But I want you to realize there are some other areas when many times people don't realize that OSHA inspectors are extremely well versed on these other areas. So let's just take a look at them. These are the other subparts. They're subparts to the OSHA Act, and they're not difficult to comply with. They're really not. But some of the things they cover: walking and working surfaces, egress, in other words, looking at signage, exit signs, that doors have a crash bar on that you can get out, ventilation, noise exposure. Noise exposure is not normally a problem in a dental office. Ventilation could be. Non-ionizing radiation. You might think, well, we don't have non-ionizing radiation in our dental office, but we do, in the form of curing lights, in the form of an electrosurge, a laser, all considered non-ionizing radiation. There's a subpart H on materials handling, of course, personal protective equipment, first aid, fire safety. And by the way, I just want you to know, we are making available to you on the, and at the end, I think it will be mentioned, but we're making available to you on the learning site for this course an actual OSHA audit checklist and an infection control audit checklist. So don't worry that I'm going over this quickly or at 50,000 foot view. You're going to have access to a very detailed audit checklist, and you can see where you're compliant and where you're not. And you're probably in pretty good shape, but probably most of you, including me if I didn't use this list, would be missing a few things. And it'll go over all the things here: fire safety and electrical safety. I think we can make it fairly easy for you. Now, I just want to mention OSHA inspections. I haven't talked that much about what happens in an inspection, but you're going to be surprised to hear me say that actually OSHA inspectors are pretty fair. We have been involved over the years, my company, in literally hundreds of OSHA inspections in almost all 50 states, in U.S. territories like Guam, Puerto Rico, U.S. Virgin Islands twice. And inspectors are almost all the same. They're actually pretty reasonable if you've done these things we're talking about. The way an inspection would typically go, they want to see that OSHA manual that has the written documents in it. Of course, the written hazard communication plan and the exposure control plan are key. They're going to want to see your safety data sheet binder or your hard drive with those safety data sheets on. They're going to want to see your records of training. That's really key. That's why I like you to keep 5 years of training records. And imagine how impressive it is when they come in. The way an inspection typically starts is, let's see your written documents. Imagine how impressive it is to that inspector when they walk in and see that you've got all these things right away. They realize this is pretty good office, this is pretty compliant, and they have a whole different attitude when they walk around and check for the posting of required documents, like the OSHA poster. They interview employees, and you might think that sounds really intimidating, but I find that what they're doing basically is saying, hey, Sally or John, do you know where your OSHA manual is here with your written hazard communication plan? Or have you ever received training? Or do you know where your eyewash is or how to use it? So pretty basic stuff. They're really not out to get you. They make some notes. They're looking at, all those other things I mentioned, like signage and egress, exiting from a facility, a fire extinguisher. They usually don't make a lot of comments while they're there. Not usually. And they'll send the results several weeks later. Now, if you've done the things that we talk about and the things that we'll show you on this audit checklist, and we're also going to give you, I actually have a QR code where you can download our OSHA and infection control audit app. It'll be in a couple slides from now. So if you've done the things that are on there and somehow you still get a citation, please call us. We've been involved in so many of these over the years. And, if you've done the right thing and an OSHA inspector made a mistake, and we've seen that, you've usually got about 2 weeks to respond, and you can send them a letter, a description. We've ghostwritten a letter over the years for doctors, and we encourage them to send along photographs and copies of your training program. So I find that OSHA inspections really go pretty well when you're prepared. Trust me, they're not out to get you. I don't know why people try to scare people with this stuff. It's not that hard, but we just need to get organized and do some of the things we're talking about here. Now, I want to mention CDC guidelines a little bit. And the reason I want to mention them is a lot of times people will say to us, or they'll call our customer service team, they'll say, well, I'm not that worried about the CDC guidelines. They're guidelines. Well, don't forget, OSHA can enforce these guidelines. I've been at joint conferences where heads of OSHA and CDC were there, and oh yeah, they nod their head about that. Yes, we can. We can enforce each other's. OSHA enforces them under what's called the General Duty Clause. That's a clause that says, look, you've got to provide a safe and healthy workplace. We can't write a regulation for every single thing you do, but you got to have some common sense. And we consider common sense following CDC guidelines. And even though this is an OSHA, keep in mind, your state dental board, your public health department, they can all enforce them as well. And if you somehow had the misfortune of ending up in court, and we all know, at least over the years I've practiced, patients are a bit more aggressive about challenging this. There's a lot of difficult patients out there. I will tell you that if you go into a court situation, the CDC guidelines are absolutely the gold standard, and you're going to be expected to follow them. So the next thing I would like to mention here is, I talked about an audit of your office. I think that it's the only way to do it, and this is something you should do once a year. We found over the years this is the best way to do it. Whether you're using our paper audit checklist or our app, you're going to spend, whoever is in charge of OSHA, they're going to spend, I'm going to say probably about an hour once a year going through these checklists. And you're basically going to take all the no items, all the yes items, great, congratulations. The no items, you're going to want to go back and then write the date that those are abated and keep those checklists. Do this every year. That way you won't forget these little things. And does the person who's doing this for you have to be an OSHA expert? Not at all. If they've got an audit checklist like this and some guidance, and we're glad to help them with that. This isn't nearly as difficult as you might think. Now, what I'm going to do here is I'm going to put this up for just a moment. Now, we will also have this on the page for this course, the information page. And Trung, I believe you're still on here. Am I using the right word? What is that page called? There's actually a page you can go to where you'll find
Oh, sorry. It's on the classroom page.
the classroom page. Yes, the classroom page. So you'll be able to access the OSHA audit there as well. But if you want to scan or grab this QR code, it'll take you right to the OSHA audit app. The other thing that I will mention is that when you attend something like this, we consider, whether you ever work with us or not, we consider you a client, and we're glad to help you. You can either email us, you can call us. We do have on staff a number of OSHA authorized trainers, so we're glad to give out that information. We feel if we can help you, you'll eventually work with us, and we're glad to do that. Now, what I'm going to do is I'm just going to go to the last slide here, and I do, before I take questions, I want to thank everybody for attending. We had a lot of people on here tonight, a lot of interest in this, and I really appreciate your interest in safety and compliance. And at the same time, I want to protect your business and all the things we talked about tonight. It's also a liability policy. We need to do this. I've been there owning a large dental practice. We have a lot of liability. We need to do these things to not put our business at risk. And at this point, Trung, I'm glad to take any questions that anybody might have. And I want to mention too, if somehow we run out of time for questions, fear not. We won't disappear into the ether on you. We actually have a technical service number you can call, and if you come up with a question next week or next month, we'll be glad to help you. Some good questions coming in. And this question is, can a dentist practice with only short sleeve scrubs, or is it an OSHA violation? Actually, I've seen a number of violations citations issued for working in short sleeves. I would highly advise you to move to long sleeves. Someone asked here, how does someone become a certified infection control coordinator? You can go to, one good way to do it, you can go to our compliance training partners website, and we have some information on there, or you can certainly call our toll-free number too, and they can tell you how to get that training. And you know, someone said here they've been wearing scrubs for 38 years. Congratulations. I've been wearing long sleeve scrubs for a lot of years. And you know, it first took some getting used to, but you know what? Once you do it, it's kind of like wearing gloves. Can you imagine not wearing gloves? Someone said here, you know, they wanted to know about random inspections, like just showing up, popping up at a dental office. That can happen. It can happen, yes. Here's a good question. I'm so glad you asked this. Does this course tonight qualify for annual requirements for OSHA training? No, I want to make that so clear. This is just a 50,000-foot view of top violations we've seen. And imagine what I've done is just take slices of our annual training program, which is about 2.5 hours long. I've just taken slices to let you see what that looks like. So no, this is not annual OSHA training. Somebody asked, Brittany asked here, where can I find labels? One source, you can certainly find them at Compliance Training Partners. If you go to the website, you'll find GHS labels available there. Another good question here, onboarding for clinical staff. Is training mandatory immediately, or do you have a grace period? Looking to update my manual. I'm going to tell you that they make it really clear that it's got to be part of the onboarding process, which is why I would really try to have some online training views available, because really it needs to be on day one. It really does, or it can be problematic for you. Someone asked another good question. Does this apply even if you have a small dental office of only 5 people? It does. This training actually applies even if you only have one employee. And let's take me, let's just say if I practiced alone, I even did my own assisting, it was just me, but it's a corporation. I'm an employee of the corporation. So basically, there's not a practice out there that this doesn't apply to anymore. Someone asked here, what happens if a patient won't comply with the OSHA request if an employee gets poked? You said we had a patient get angry when asking, are we still in compliance? Absolutely, you are, Carissa. What you need to do is give that patient the opportunity. If they refuse, we cannot force them. I'd certainly just get them to sign off on that sheet. Again, I'd mentioned the sheet for the employee, sheet for the patient, sheet for the occupational medicine clinic. Get them to sign off. We can't force them to do that. We certainly experience that ourselves. Most patients are glad to do it. Some will not. We can't force them. Good. Someone else asked that question too. Sure. Another one. Right immediately after hiring, that's when training has to be done. Here's a good question. The dentist I work for doesn't wear eye protection when working on a patient. How do I tell him respectfully that he should? You know, Jennifer, I'll tell you what. In our training, and I wish we were doing the annual training tonight, I actually have a slide in there that shows a piece of amalgam in the eye. It looks pretty ugly. I guess what I would say is, it sounds like I really appreciate that you're trying to do it respectfully. Just say, look, I really like working with you. I'm worried about you. You know, I read that these handpieces go at 200,000 RPMs, and a piece of metal could go into your eye at like 100 miles an hour. So I just would encourage that you know, you're concerned about them, because they're really, it's really very, very dangerous. It would make my hair stand up on end to work with a high speed without glasses on. Let's see. Someone asked here, can they use disposable lab jackets rather than laundering? Yes, you could. In fact, during COVID, we did that, but the waste stream was so enormous, just bags and bags of those things. But if you want to use disposable, absolutely you can. I think laundering them is probably, you know, a better solution. Someone asked here, this is a good question. This is getting into infection control outside of OSHA, but I'm glad to answer this. If the sterilization cycle in the autoclave is done, can we stop the drying cycle and let the pouches air dry on top of the counter? Here's the problem, Diane. If you're doing that, technically you're not following instructions for use, which say the drying cycle needs to be completed. One of the big problems I find is when you're handling wet packages, they can often get tears that are either visible or micro tears. And as we know, when they're torn, they're no longer sterile. So I would really like to see you running it through the whole time. And I always say, if you're having to do that, you probably have one of two problems or both. Either not enough autoclaves, you probably need one more, or not enough instruments, you need more, or maybe a little bit of both. Thank you, Grant. I appreciate that. How do we get access to annual OSHA training we offer? That's something you can just go to the Compliance Training Partners website, and you'd be able to find that and take a look and see if it's something interesting to you. Now, someone says here, if a dentist is not an employee, is it still a violation wearing short sleeves? First of all, I mean, I wouldn't want to do that, but let's just say it's really rare today to find a dentist who is not working in a corporate environment. When I mean corporation, where they've actually formed a corporation, whether it's a PC, an LLC. I mean, if they were out there practicing as a sole proprietor, that would be the legal definition of their business. If they were going as a sole proprietor, technically they're not an employee. That's really rare today. That would be the only case where technically they're not an employee. Does proof of a TB vaccine apply to new hires or just if an incident occurs? Actually, to new hires. Everybody should have a baseline TB test. And again, just one time. Brittany, this is a great question. What if a patient doesn't want to wear eye protection? What if they choose to wear their own eyeglasses? Are they sufficient enough? You know, you can't believe, and Google up sometime eye injuries in a dental office. It's just some horrible stories of, imagine a high speed with a burr being dropped into the eye with loss of complete loss of vision of that eye. Endodontic files, broaches, reamers being dropped into eyes, needle and syringe being dropped into the eye, an endodontic low-speed handpiece with a rotary file dropped into the eye with complete loss of vision. The problem you have with regular eyeglasses that a patient wears, a good pair of safety glasses has side coverage, and also if you notice, they fit tighter down around the malar strut, down around the cheekbone. So they really provide better protection. And so many times, because the patients turn back like this, that high speed throws it in underneath. So I would insist, and it takes a little sweet talk. You might say, oh, Mrs. Smith, I know you want to wear your own glasses, but we really care about you. And we've heard of incidents where people have had severe eye injuries from not wearing actual safety glasses. You know, Grant, you mentioned something here. You said 38 years ago, a lecture showed a video with dye in the water system, how much contamination takes place in normal restorative. Yeah, that was called if saliva were red. And yeah, that's an amazing thing, isn't it? How the whole operatory just gets covered red. If you haven't seen it, it's old. I mean, it looks dated, but it shows, Google up sometime, if saliva were red. Someone says here, for temporary workers, I understand we have to provide the clinical function training, but how do we document hepatitis B and TB offered? Do we have to offer and document for temporary? You don't, Jessica, because you think about it, that would just become just impossible. Here's what I would say. This to me is a good reason to work with a temporary agency where, or somebody who you're hiring actually has their own corporation, rather than just hiring somebody off the street. Because technically, if you hire from an agency or a person who has a business and they do it out of their business, now they're responsible, right? They have to provide for that business the hepatitis B immunization, the TB baseline testing, because, you know, it would just be impossible, right? What if you just had a temporary one time? You can't afford nor take the time to do all that for them. So hire from a legitimate company and ask the question, hey, we're going to use your temporary agency. Do you have, are these employees, is there been training? Have they been immunized against hepatitis B? Do you check all that? I would ask them. If your assistant wears eyeglasses, are side shields enough? Or do they need a face shield or large safety glasses over glasses? You know, I will tell you side shields are better than nothing, but the only problem is you don't really have actual, whether it's called Z87 approved safety glasses. I think an ideal thing, if they're going to wear their own prescription glasses, would be a shield. I really do. I'd rather see them do that. Or, you know, if they invest in safety glasses, you can buy safety glasses and have prescription lenses put in. Someone asked here, jogger scrub bottoms are so popular, are they compliant if the ankles are not covered? Yeah, you know, they'd be okay. I don't think you'd be cited for that, but make sure that either one, they're being washed in the office, or two, again, that person is wearing a knee-length, long-sleeved lab coat that is laundered at the office. Someone mentions here, can you wear short sleeves with a long sleeve gown over top? Absolutely. Absolutely, you can do that. Oh, thank you, Lana. I really appreciate that. What do you suggest I do if a TB test was not mentioned upon hire? I know what you mean. You don't want to create any problems. I really think the way to do it, if my staff, if I'd never done it, I'm like, geez, I should have done it, I never did. I would say to them, I would say, you know what? I took a course. Although it's a low risk in dentistry, I'd like to get you all a baseline TB test. Haven't done that before. Let's get it done. I guess I wouldn't go into saying, oh, beating yourself up in front of them, saying, oh, I should have done this. It's been the law. Just say, I'm doing I want to help you. I want to protect you. Let's get this done. I've made an arrangement with a local occupational medicine clinic. Here's a good question too. Again, back to temporary employees, hygienists and assistants. How is their testing training regulated or insured? You know, I guess what I would do, Alyssa, I would make sure that whatever temporary agency you're dealing with, you at least exchange an email with them so there is a record. We are going to be using you as a temporary service. I just need to have confirmation that you do provide training, that you, for example, provide baseline TB testing, that your employee is immunized against hepatitis B. So I want to see an email back from them that you save saying, yes, we do that. Now, whether they do it or not, you can't prove it, and you don't have to. That being said, Alyssa, I would make sure that when that temporary employee comes in, you give him that quick 50,000-foot view. Hey, Sue, you're going to be at our office today. I know it's just today, but let me walk you around. We've got an eye wash here. If you have any questions, I'm the one who's in charge of OSHA. If you had a needle stick or anything, I know you've been trained at your job, but come to me. We'll be able to handle all that. This is where we put our sharps. I mean, just a basic, I'm talking 10-minute safety briefing, because it's not realistic, right, to do a full OSHA training. You can't do a 2-hour training for them, but do document that you've done this. You don't need a signature from them, but document it in a file for temporary employees. Can you sterilize instruments that were sterilized already in the same pouch? In other words, maybe what you're talking about is you find your pouch is torn. So you say, I need to re-sterilize this. So can you just drop the whole pouch into that? I wouldn't, because now you've got double thickness. You'd be concerned about getting steam there. Just tear open that pouch, put all those loose instruments back in a new pouch. Someone says here, I got kicked out of the Zoom meeting for some reason, got back in, but wanted to make sure I'll still receive credit. You will, because at the end, Trung from Viva Learning will talk about that. You'll be able to get credit, no problem. You are welcome, Jessica. Teresa, you asked, can they refuse a TB test? Yes. Yes, they can. I would certainly give them reasons why they should have it. But yes, they can refuse the TB test, but document that you offered it, please. I always tell this is a good one. Someone says, I always tell my patients personal glasses will get debris on the lens. We're giving you safety glasses. And that's a great way, because you let them know, hey, look, there's pieces of metal and really abrasive debris that could ruin your glasses. Yeah, get them to take off those glasses. That's a good idea to say that. Do you have to be a dentist to become an OSHA compliance officer? Well, in my case, I mean, it's just that I've gone through, it's weeks of training at the OSHA Institute, but I'm actually certified to train even in factories and farms and all types of things. But does the person in your office who's in charge of OSHA need to be a dentist? No. It needs to be a knowledgeable person, and that's why I'm a real fan of third-party training that's documented. Here we go. Someone says that they have used a Technol, Technol, protective disposable mask and shield over RX glasses. They don't fog. 23 years you've used them. All right. Technol, maybe look that up for people who have glasses. What about employees who are vaccinated for TB in other countries? You know, again, it's not really that there is an immunization for TB. It's a TB test. So a tuberculin skin test to see. So if they said to you, well, we were tested for TB in another country, even if they were tested in another state, it doesn't matter. If they're a new employee for you, you need to get a baseline TB test for them. Again, it's not a vaccine, it's a test. You are welcome, Pat. Here's a good one. Is there any documentation needed for students shadowing in the office? Hannah, that's a really good point, because, you know, what happens if somebody gets a needle stick or something? I would make sure that you do, again, that quick orientation course. I would make sure that you keep them out of harm's way. Would I have them recapping needles? I wouldn't. They haven't received training. You don't have proof that they've been immunized. And if all of a sudden it happens on your watch in your office, you could have some liability. And I've seen that happen. I've been involved in cases where that happened. So I would certainly give them the quick tour, let them know who's in charge of safety, if they have any questions, and document that. Can you put SDS for materials you no longer use in a separate section of your binder for retired materials? Absolutely. I would even put them in a separate binder so your binder's not so thick, because you need to keep them for 30 years. Basically, that binder of old materials is going to go to the new owner of that practice someday. The office provides reusable gowns but requires us to bring it home and wash it. Is that okay? It is not. It is not. You can't be wearing your protective equipment at home. If it's a reusable gown, it needs to be washed at the office or picked up by a laundry service. Brittany, you're welcome. The questions are the best part, right? Sometimes I think we learn more from the questions than my presentation. Is OSHA training supposed to be done during regular business hours? Are we supposed to be paid for work? Yes, and if you're going to give that new employee, let's say you gave that new employee the maybe the online course, maybe you have our online course, and it's going to take 2.5 hours, and you want them to do it at night because you don't want them to use productive time in the office, they should be paid for that time, yes. Thank you, everyone. I think I'm running a little over, and I don't want to do that to Viva Learning. Thank you, everybody, for coming out, your interest in safety. And again, we won't disappear on you. If you have questions, please contact us. We're always glad to help.